Major funding for Battling Opioids has been provided by...
It doesn't take long to become addicted to opioids. 13 Pennsylvanians die from them every day. Geisinger is committed to ending opioid addiction with both prevention and treatment. In the last 3 years, we've reduced the amount of opioids we prescribe by 50%, and we've opened 4 medication-assisted treatment centers across the state to help patients recover from addiction. Learn more at geisinger.org/hadenough.
Additional support has been provided by the Commonwealth of Pennsylvania and viewers like you. Thank you.
It affects newborns, adolescents, teens, adults, and senior citizens. Opioids do not discriminate.
When I lost 15 friends that year,
it's heartbreaking.
With 5,456 overdose deaths in Pennsylvania in 2017 and over 2,000 infants born with neonatal abstinence syndrome in 2018, the impact of opioids on children and families in Pennsylvania is devastating.
She said, Daddy, I just don't want you to be sick anymore. I miss you. I don't want you to be sick anymore.
Pennsylvania's public media stations are confronting this crisis head-on. In the next hour, you'll see and hear personal stories of those affected by this epidemic, as well as available resource information for those in need of help. Recovery starts with a call. Call 1-800-662-HELP.
There's never a dull moment, and it starts from the time that the kids walk in from school with the homework,
95. I like
and dinner and cleaning up.
Yeah, it gets a little noisy. I'm Satina Hendel, and I'm a foster mom.
And I'm Troy Hendel, and I'm a foster dad. We've been foster parents for a little over 2 years, and we've taken in 7 children. In every case with the parents, there's been drug abuse.
The opioid crisis has had a profound impact on the foster care system. Sometimes parents are being arrested. Sometimes we receive referrals that they have overdosed, and the trauma to children is pretty profound. Our first attempt is to place children with extended family, but oftentimes we're finding those extended family members are using drugs themselves, so we have to find foster parents to care for the children.
A little over a year ago, we received a phone call about identical twins that needed a home. And wow, identical twins.
There was drug abuse with the parents. There was times when the parents were in jail. The girls have been in the system since they were 3 years old.
You hear stories of kids that just stay in the system and they don't get a home. We all have a picture painted in our mind of a child that's been in the system. You're expecting someone who's very shy, someone who has a lot of fear coming into a new home. But these two here, they were excited. It was a new beginning for them, it seemed.
You can help me do salad? Our daughter, Kaylee, she's 17. She's like my right arm. She does a lot. She has a great bond with them. They're sisters. It's not always easy. They have fears, they have rejection. I tell them, we're not trying to replace your parents. We just want to be a parent to you. We just want to love you, and we just want to care for you.
When we first got the girls, less than a week had went by, and they said to us, in our next hearing, they're going to talk about us being put up for adoption. You could adopt us. And when you hear someone who is 12 say that, it's like they're tired. They've had enough. They've had enough. I love you, baby.
We've had the twins a little over a year, and we adopted last week.
If we can change a few lives and stop the cycle, then we've done something.
Children deserve to have a forever family.
Just a little bit on it. So despite all the noise and the chaos, we're a family. We're a family. We're gonna have salad first.
Recovery starts with a call. Call 1-800-662-HELP.
Ben was a very joyful, happy-go-lucky little boy, and just filled the rooms with joy everywhere he went. But Ben was like a typical teenager. He thought he knew best, and he was smarter than the adults in his life, so he oftentimes did what he wanted to do, and it ended up costing him his life. My name is Rhonda Miller, and I lost my son Ben to an opioid addiction. I tried to work with the large public school that Ben was a student at, and they didn't, at that time, seem to have the resources or really know what to do with him. None of these schools provided the level of support that he needed to help him with his addiction.
At Colby Academy, because we're built to be small, up to 90 to 100 students, we're going to actually have that incredible opportunity to get to know these kids on a level that is unbelievable.
We're doing this because we're Catholic, not because those that we serve necessarily are. So we realize there is a spiritual part of the recovery process, but those coming to us that we'll be able to serve aren't necessarily Catholic, may not have any faith at all. Students and adolescents in the Lehigh Valley are struggling with substance abuse disorder. This is an opportunity for us to infuse academic excellence with intensive recovery supports and to fill a void within our community.
It's heartbreaking sometimes, it's heart-wrenching. You want to be able to wave a magic wand. You want to be able to just say, okay, I'm going to take care of this. And you can't because you just don't have that ability. And I think that's our human nature as teachers, as principals. We want to help our kids no matter what situation they're in.
My son suffered from addiction during his high school years. He's been to treatment 19 times over the past 7 years. He's still uncovering, trying to understand what triggered his addiction and where it all stemmed from. My son Joseph has been clean and sober for a year now. He became the proud father of a little boy. I became a board member for Colby because I believe in the mission of Colby Academy. I know that they're going to save lives. I know they're going to make a difference in the families in the Lehigh Valley. So my hopes for Colby Academy are that more people in more communities will see the need for a recovery high school.
This is the first faith-based model in the nation. We're creating a culture of recovery. It's a typical school day. We want them to have the experience that every other high school student will have. However, we recognize they have unique needs, and we want to make sure that they have the right support in place. So we lost 74,000 lives last year. So for us to think a little out of the box to be sure that kids can get this support, we need to do it.
We don't have a lot of adolescent resources or even treatment centers available in our state, so to have a school that can help them is just awesome, to get an education and the recovery that they so deserve.
Recovery starts with a call. Call 1-800-662-HELP.
So I started using in high school. I didn't graduate because of that. I did eventually get my GED, and then I spent roughly 4 years doing absolutely nothing with my life. And around the time I was 22, I kind of just woke up and realized that my life was going nowhere and I needed to do something different. I spent 2 years just caring about recovery. Because of the support that I had in the recovery community in State College, I realized that I could get an education. And so I applied to Penn State and I got in, which was like the best day ever. I never would have been able to think that I could get into Penn State.
Addiction's a chronic health condition, and a lot of chronic health conditions require ongoing support to make and sustain major lifestyle changes. Without support, a lot of students have a really difficult time getting their lives together. Penn State Collegiate Recovery Community is a program of student affairs that was started in 2011 to support students in recovery from addictions. It gives them the very best chance they have at success. Pursuing academics while in recovery in a program like this, they got a better chance than they have anywhere else. So what happens with a lot of these students is that after a while, they don't experience the pressures that people think they must be experiencing. To them, it's a totally different experience going to college. And they don't see themselves as partiers anymore. They see themselves as a totally different person pursuing a totally different set of goals. This is not a substitute for a program. These are students that are expected to work a program in addition to the CRC. So we don't replace the existing recovery programs they have. By expanding the continuum of care, by providing a collegiate recovery community, students have the ongoing support they need by the university to succeed within their university.
It is very important to have a recovery community on campus. Without this community, I feel like students are less likely to succeed in their education as they pursue recovery. So the Roar House is housing provided on Penn State campus for students in recovery. So that means I'm living with people who are in recovery, and that means that I have even more support in recovery. Drinking and using destroyed me. It made me into a very terrible person who lied, who only thought about themselves, who would do anything to just get a fix. But recovery has taught me that that part of my life is an asset. I no longer regret those things. I know that my story can help other people. For me, the most important thing in recovery is to remember that I am in recovery, and I will be for probably the rest of my life. Today is all that it matters. Today is the day that I need to stay sober. Today is the day that I am in recovery.
Recovery starts with a call. Call 1-800-662-HELP.
I'm John Hartnett. I'm the Recovery Service Navigator with the Meadville Medical Center Foundation's Let's Talk Overcome Addiction campaign. I am a person in recovery from a substance use disorder. I became involved with the recovery community in 2015 when I lost 15 friends that year. I went to 15 funerals, and I was engaged in a period of abstinence at the time. I'd become fed up with drinking and drugging. So I got engaged with mutual aid fellowships. They recommend service. Given that I had lots of friends dying from opioids and other drugs, I got involved with support groups. Not One More Northwest PA was started by mothers who were concerned about the dearth of resources for them to find out how to help their children. In 2018, I was blessed to be named president of that organization. Shortly after that, the Let's Talk campaign was looking for a recovery service navigator, and it was essentially my role in the community anyways. Now I am proud to work for Meadville Medical Center and have access to people that have medical episodes because of their substance use disorders. And I can help them and their family members navigate the treatment process. So it's really a blessing. This event is titled Let's Talk Recovery in Our Community. It's part of the Let's Talk Overcome Addiction campaign. And literally we just would love to get people from all walks of life together talking about this issue so we can work out some solutions through community collaboration.
The biggest reason how I got involved with the event was I actually know John fairly well, but it really became a collaborative effort. And so on the ambulance side, we're kind of the first line of defenders of trying to get the situation resolved. And if we don't work together, we can't get the patients to the hospital. We need to know each other's job. So we've kind of worked together to educate each other on our own jobs and hopefully kind of streamline the situation through. So.
Well, we have been very blessed to work with John Hartnett, and he has helped us in many of the events that we have put on, and we were happy to come today to support this event that he put on. We have to keep this conversation going in the community. It's vitally important that we fight the stigma that's attached to this disease, and I know many people don't understand the disease concept behind it, but it really is a brain disease that people get involved in. And one of the biggest messages that we support, and that I know that John supports through this, is that recovery is possible.
Recovery starts with a call. Call 1-800-662-HELP.
It all started freshman year of high school. I woke up one morning like in excruciating pain. Got rushed to the hospital. They thought it was appendicitis. It wasn't. The pain continued to happen. I saw doctor after doctor. No one could figure out what was going on. Throughout this whole time, I'm in pain, in and out of the hospital, emergency rooms, being prescribed medication left and right. Percocet, Vicodin, whatever. So it got to the point where like I woke up one morning and I could not stop taking them. I did my detox. I was there for 6-7 days maybe. Not long after that, I ended up getting pregnant. I stayed sober through that pregnancy. Not long after I had her, I started taking pills again. My first was about a year old when I found out I was pregnant again. I was still using at this point. I couldn't stop. One of my friends that I grew up with had been in recovery for a couple years. My brother called her, she came over. They told me about Jefferson.
Maternal is a program that's been in existence for over 45 years, and it's a maternal substance use treatment program. Mostly the women who come here are pregnant and have been exposed to opioids.
Getting home to food shop, or take them shopping for clothes, or get diapers, or formula. Trying to balance treatment with real life was really hard. After about a year and a half being a client here, I saw a sign for this new research study that was happening for mindfulness-based parenting. It's all about being in the moment and like being okay with what is now. Not the past, not the future.
When moms in our program do mindfulness, their parenting quality improves beyond the general public's.
My parents were my rocks. Always have, always will be, and if it wasn't for them, I don't know where I would be right now. But those relationships were not always wonderful. Like, I did a lot of damage when I was using, and even in the first couple of years of recovery, living there and being a burden. Like, they would say I wasn't a burden, but I knew I was. But with mindfulness, I've learned to, like, I put myself in that position. I'm still living at home today because of choices that I've made a long time ago, and I haven't been able to dig myself out, but for the most part, I'm doing good. There's a huge difference in the way I parent because of this course that I took. So after I was done the first one, we had like a little graduation and a pizza party, and that's the first time I met Diane. And afterwards, the first conversation afterwards, she said, "You're gonna do big things. You're gonna be my coworker someday. Like, you will be a part of this, of Maternal." And I was like, yeah, okay.
When I sat next to her, what I realized was I'm learning. And I thought she could be a content expert. We could really improve care if we have her here.
I don't tell everybody my story. Not every woman here knows what I've been through, but if I feel like it'll make a difference, I'll tell them. And I have a few women who are like, if you wouldn't have told me that, I wouldn't still be here. So it makes a difference, and it just, giving back what was given to me really helps.
Recovery starts with a call. Call 1-800-662-HELP.
Danny was the life of the party, just kind of a great person to be around. His addiction really, I think, took off, and I think the stress of knowing a child was coming is kind of what led to the downward spiral.
I put a lot of burden on her shoulders while she was pregnant. I really wasn't there emotionally. I really wasn't there to connect.
That's hard for me to talk about it. It's supposed to be a happy time in your life, and it wasn't.
She had an emergency C-section, and I had to put on scrubs. And in my pocket, I had 3 Oxy-80 pills. Normally, I would just take 1, but I didn't want anyone to see what was in my pants pocket, so I took all 3 before I went into delivery. When my daughter was handed to me, I could barely hold her. I ruined that moment.
I wanted him to get things together. I mean, I wanted the perfect little household. He would always tell me that he was trying to get sober.
Maybe I could go to the doctor, get that product. What was
Suboxone.
It called? Suboxone. Take the Suboxone up until, like, right before my vacation. Then I could stop the Suboxone, quit cold turkey, because I have the whole vacation. You know what I mean?
One of the lowest points of my entire life.
My daughter was asking where he was, and the only thing you can tell a 4, almost 5-year-old is that he's sick.
During that rehab, someone asked me, they said, what's the #1 thing in your life? I said, my daughter. He's like, I'm sick of hearing people say that. You need to be #1 in your own life, or she's not going to be there. Later that day, I got on the phone with my daughter, and she said, Daddy, I just don't want you to be sick anymore. I miss you. And from that moment on, I started writing my daughter's name on my hand to get me through the day. My daughter was ultimately the driving force in me wanting to be #1 in my own life.
He looked so much better. I was cautiously optimistic.
It takes time for people to understand, are you going to stay successful?
He had a lot that he needed to do before I felt comfortable with them seeing each other. And he did. He continued to, slowly.
I had set goals, and I had let Lindsay know that my 90-day goal, I want to take my daughter to Hershey Park. And in that time frame, I didn't really get my daughter. And it's very tough as a parent. But what I would do is I would take that as motivation and be like, I'm never going to live like this again. After that 90-day mark, I got to take her to Hershey Park, and it was awesome because I could see life through her eyes.
That saying, time heals all wounds, is so true.
Now looking back on it, I couldn't be more grateful that she has a mother like that was protecting her best interest.
Look at Kaden coming. She's coming.
2 months ago, I moved out of the recovery house, and I moved into my own place. And I have a bedroom for Kaden, and I've experienced my first 2 overnights. I couldn't remember the last time I put her to bed. So you're talking years of not having these moments that I really fought to have. And this is why I'm going to keep doing what I'm doing, because this is what life's all about. She's just the best thing that I've ever created in my entire life.
Recovery starts with a call. Call 1-800-662-HELP.
I'm Allyson Pretty-Hopkins, and 3 years ago started Grand Love, a support group for grandparents raising grandchildren to provide them with education and support. A lot of our grandparents come to the group with the same background. Their children have become addicts. There are some grandparents raising their grandchildren out of neglect, but by and large, it is because of the opioid crisis. Their children have become addicts and can no longer be a parent.
I'm raising my grandson, Daniel. We got a phone call from my daughter. Both mother and child tested positive for narcotics. I didn't want my grandson to go into a foster home, so my husband and I brought him home with us, and he's been with us ever since.
We have 2 grandchildren. Joseph is 6 and Ryan is 5. When their mother got pregnant with Ryan, Ryan was born addicted. He was in the hospital for 3 weeks going through withdrawals.
When I brought Daniel home, I remember the first night, and I looked at him and I thought, my God, what did I do? Because I was 55 at the time.
When they come to this group, they're talking about how their whole dynamic has changed and how difficult that can be.
Yeah, it has changed our lives tremendously.
You know, this was never my plan for my life. This was never my idea to be 65 and ready to retire and have toddlers. This environment provides them that safe place to talk about that.
Raising Daniel, because he has some difficulties and such, that was a major challenge.
Very often they're not getting healthy children. Most of these children have some level of special need. Very often it's from trauma, it's from prenatal exposure to drugs and alcohol, it's from abuse.
Their normal is never going to be normal. They're always going to have problems.
There was a grandparent that said, I know a lot of women that have 5-year-old children, but I don't know a lot of 60-year-old women with 5-year-old children.
It's not as easy to be my age and to be running around trying to do all these things for someone.
These kids are energetic and they want to play. Yay! It's difficult when you're doing that in a home with a 65-year-old or older grandparent.
They are very active. I'm exhausted all the time. But, you know, you do what you have to do. It doesn't matter how tired you are, nor does it matter how sick you feel. You have to keep going anyway because they need you.
And the financial impact is huge. They're selling off properties and, you know, giving up retirement and going back to work, but they're depleting their own resources at their own expense.
Financially, it was a rude awakening when we brought Daniel home because we weren't prepared for the cost. We weren't able to retire as a couple.
At this point in our lives, we never expected to be as financially strapped as we are and didn't realize how much we were going to worry about retirement because we cannot fund our retirement. It's a sad situation and it's becoming so common. I think the biggest problem is that people just, they don't understand. They don't understand the situation unless they're in it.
Over the past 30 minutes, you have seen incredible personal stories of courage and hope. Hello, I'm Paula Giacomo. Tonight, we're uniting to discuss how families are confronting the epidemic of heroin and prescription opioid abuse and the impact that the epidemic is having on all members of the household, from newborns to grandparents. This program is being broadcast throughout the Commonwealth on Pennsylvania Public Media. Recovery starts with a phone call. If you or someone you know is suffering from addiction, please call 1-800-662-HELP or visit battlingopioids.org. Phone lines are now open. I'd like to introduce you now to our panel. Senator Gene Yaw represents the 23rd Senatorial District and serves on a number of boards and commissions. He is the chairman of the Center for Rural Pennsylvania. Allyson Pretty-Hopkins is a medical home care coordinator with a 22-year background in healthcare. She facilitates a support group for grandparents raising grandchildren known as Grand Love. Cammie Anderson has worked as a drug and alcohol prevention coordinator for the past 27 years, helping students, faculty, and families dealing with substance abuse disorders. And Jamie Ferry is the prevention supervisor at Crawford County Drug and Alcohol Executive Commission and coordinator for the County Overdose Prevention Coalition. I'd like to thank the panel members for being here tonight. Senator Yaw, I'd like to address you first. This opioid and heroin abuse epidemic has devastated families all across the nation and in Pennsylvania. And you, as the chairman of the Center for Rural Pennsylvania, you've been holding hearings and talking with people in your district one-on-one about the opioid and heroin abuse epidemic and how to combat it. What have you heard from people in your district about the result of this epidemic, the grandparents who are left to raise these children who lose their parents to addiction?
Several comments about that. I mean, I think that first and foremost, grandparents are the logical place to go when something happens, and that may not be correct, but that's the place where everybody goes. But what we have found out in the hearings that we've had is that grandparents in their 50s and 60s are all of a sudden have the responsibility of raising young children in another family. It's devastating. It's devastating to the personal relationship. of the people at the time. It's devastating to the kids. All of a sudden you have older parents, so to speak. Just the transportation alone in today's world creates issues, financial issues. A lot of people, there are numerous people right now that are living on Social Security and trying to support another family.
Right.
So when you put all that, and then plus the little things that happen, just the legal things, what's the legal right to enroll a child in school, to get them medical care, or to do anything else that's required for them? It's a huge problem.
It's stressful because these people were planning to retire, and now they have to transition from planning retirement to raising a family all over again. Allyson, you work in pediatrics, but you even noticed a need for grandparents who needed support, and you started a support group?
Absolutely, yeah. 3 years ago, started Grand Love, a support group for grandparents, and initially it was created to help get them information and provide them with support. It's difficult for them to admit openly that they're struggling, that this is a tough situation for them, and it's embarrassing. So this group provides them with that environment to do that, but equally so we see a lot of grandparents doing it quietly. They've assumed the grandparent role. Their children are kind of in and out of the grandchildren's lives. They haven't taken any legal measures to have custody or guardianship of these children out of fear and shame. So the group is designed to help support them to do that in an appropriate and legal manner.
And to answer questions that may arise.
Absolutely. Offer them guidance with educational services. Very often they have questions about an IEP or a 504, and they don't know who to go to ask those questions or how to advocate for the grandchildren.
Sure.
And that environment provides them with that information.
It's overwhelming, I can imagine. Cammie, you have been working with children, students, faculty, family, teachers about substance abuse for 27 years.
Yes.
Now, I would imagine that some of these children that are being raised by their grandparents, do they have difficulties, issues, post-traumatic stress?
Absolutely. There's a number of different issues. For some of them, they're just dealing with the fact that their parents aren't there. Whether it is they left and they feel abandoned, or if they passed away, or if they're incarcerated. So they deal with those issues. The other issue I see a lot is, I think, and not just grandparents, but even parents, aren't really educated on the field of drug and alcohol. So again, at 60 years old, it really is a different world when we're looking at substances and what's out there and what kids are facing. Take away even the drugs. Just being a teenager today is a lot different. So yeah, they are dealing with a lot of issues. I think it is our job to really educate.
Speaking of education, how important or how young do we have to start educating our kids about drug and alcohol abuse?
The program I work with, I work for an outpatient facility, but I work in a district, but we start in preschools. So we talk not necessarily about that, but we'll talk about being healthy and putting healthy things in our bodies. We make it very age appropriate, and we go from, preschools all the way to senior centers. Education, I think, is the key when it comes to this.
What advice do you have for parents who can take that education process at home? What should they be?
Follow through, find out what is going on in school, or there are great YouTube videos, there are great things they can do on their own, but call their school and see what they can do, but always talk to their kids. Just talk to their kids and if there's a program out there that they can get to help educate themselves on what's going on, get to it. I think that is our key. I know that is my big push all the time. The school is great because I have a captive audience. I want to get to the parents. I think it's important that parents truly, because I don't think if I was living this life every day, I would understand what was available to my kid when he was going into high school.
Parents
need to be
involved.
Vigilant, absolutely.
Sure. And again, if you or someone needs help, recovery starts with a phone call. The phone call, 1-800-662-HELP. I want to get to our Skype interview. This is Jamie Ferry. She is in Erie, and she is with a coalition in that part of the state. Jamie, what exactly does the Overdose Prevention Coalition do?
Well, we have several subgroups that we work with. So our youth group that we work with them specifically about developing social norms, about putting protective factors into place that help work against the risk factors that they have going on. We work with healthcare professionals, whether it's with neonatal abstinence syndrome or the PDMP, the Prescription Drug Monitoring Program, and further education efforts with them. We have a fitness group that we work with that there's a distinct tie-in with recovery in physical fitness. And so we do things like a recovery 5K with that group. We have a faith-based group. Our faith-based organizations are one of the points of contact for people who need assistance or their families who just need that loving support. And they do face a lot of stigma and they don't know about resources. And so our faith-based community is a perfect place for them to access those resources. We have a couple other subgroups. There's a school-based group that works specifically with the schools implementing programs. And then one of the other groups that often gets forgotten about are our first responders and the vicarious trauma that they are subjected to because of the calls that they go on, because of the things that they see, the experiences that they have. And so we work on fighting stigma that they have because of their jobs and really promote that message that recovery is possible and that there is hope within all of these groups.
It sounds like you cover a wide variety of issues that are arising from this epidemic. What exactly do you do for children?
We have a number of different activities that we go to, that we interact with the kids. We do a lot of in-school programming. And like I believe Cammie had referenced, that you start with some of those risk and protective things. You teach them refusal skills. You teach them good decision-making skills. You help them to see that, like with social norming messages, that people say, well, everybody does that. Well, everybody isn't doing that. We use the PAU survey to help us to develop some of those messages so kids see the truth that they, from within their own county, of what students are actually doing, and that helps fight some of the, well, everybody's doing it, so maybe I should try it type of thinking.
Okay, sounds helpful. Senator, it seems like with grandparents having to be so involved in their families' lives when someone is going through recovery or abuse, grandparents may feel overwhelmed. Are there any programs out there or incentives or tax breaks that they can take advantage of and may not know about? And where do they start?
Well, the federal government, I think in July of last year, I think the name of the bill is Grandparents Raising Grandchildren Act. And the whole purpose of that bill was to find a central depository to collect the services that are available. That's the function or the purpose behind the bill, is just to make people aware of what services are available, because I don't think that we had anything like that. And then in October of 2018, the governor announced basically a kinship type program where Pennsylvania had gotten, I think, around $480,000 to do kind of the same thing, to collect the services, make them known to people, because you hit the nail on the head. Somebody in their 60s all of a sudden had to start all over again with a new family. They just don't know where to go. And that's the idea now.
And there could be free resources out there that they're not aware of.
That's absolutely correct.
There could be free daycare, free health care. Didn't President Trump sign legislation too?
That's the act that I mentioned originally in July of last year, was signed by President Trump. So everybody's aware of it, and everybody looks at it like, we have services out there. We just need to tell people and get them collected. Okay.
Is anything happening in the state within schools to help children?
Not as much. Well, yes, I think that a lot of the schools do similar to what Cammie experiences. But I think that we need a program more along the lines of what we did with the smoking program. Really, we turned that ship around in a very small period of time, frankly, and we need to start with, just like she said, with pre-K. We need programs throughout school to tell people about the dangers involved and how easy it is to become addicted to bad drugs.
Sure. Cammie, what programs are available in schools in the school district you work for?
Well, the school district I work for, we do a lot of evidence-based programming at different age levels. But again, I work for an outpatient facility, Children's Service Center, Robinson Counseling Center, and we implemented these. But schools have a lot of these programs themselves, and when they're done through health classes and through teachers, they're extremely effective. But it kind of has to go all the way through. We can't just hit one grade level. We have to make sure we're being, kindergarten through 12th grade, and it has to be a whole community that does it. I think Tunkhannock works well because it truly is a school that is really working together for these kids.
Yeah, how do you follow through once they are in these programs? How do you follow through to make sure it's actually sinking in?
Well, we keep going in every year, so they will see somebody, a health teacher, myself. We're always there, and we're always doing some kind of programming. It isn't just education either. We do a lot of peer helping. We have student assistance program. There's a lot of programs in school that kind of keep making sure that kids are getting that message, because the other message, the negative messages, they're getting them all the time too. So we need to combat that every day. So sometimes they might hear a lot of it, but it's never enough.
What is the drug of choice these days in schools?
In high
is
schools?
it starting, as low as middle
young. Right
school?
now, well, obviously we start the youngest. We see kids now vaping. We did such a great job getting rid of smoking that they found vaping as our newest, and that's very young. We still have kids who use marijuana, but unfortunately right now they're using THC, which is a very high concentrate of marijuana, almost 93% pure.
I heard there's pills called Molly.
There's still Molly. We still have prescriptions. Those are kind of leveling off. I think education really kind of jumped in there too, where we lowered, we weren't talking about prescriptions 10 or 15 years ago because we didn't see the problems with pain. We didn't have them in our medicine cabinets. We lowered that. I start talking about that in 3rd grade. I start talking about the dangers of medicines and why you don't take somebody else's medicine, and then again make that very age appropriate. So we're seeing that hopefully leveling off now. So
okay. And again, if you know of someone or if you need help with addiction, please call the number on your screen, 1-800-662-HELP. It's a hotline. The lines are open, and there is someone ready and available to answer any questions. Allyson, these grandparents that are left with children, I can't imagine the burden that they must feel trying to raise these children. It's not just 1 or 2. In some families, Senator, you were even saying it's 4 children. How do they deal with not only the stress, the financial burden, the free time that they once had?
They're struggling, and very often they're not dealing with it very well. They're grandparents that are going back to work to be able to support them. They may not all qualify for daycare subsidies, so they have to balance a part-time job with their school and whether or not they can afford daycare. They're struggling with their role as a grandparent to those children that they're now raising and their other grandchildren, and their role as children, as parents to their other children that are not addicts. And there's a fine balance in that dynamic that they're trying to figure out how they fit into all of that.
I mean, 1 in 5 grandparents are raising grandchildren, and 1 in 4 of these grandparents have disabilities. How do they deal with their own health issues in addition to dealing with these children?
It's a struggle. There's not a lot of information being pushed out to families. So they're doing this a lot in secret because they don't know where to go.
And because of this epidemic, we've also seen a rise in the number of children in the foster care system. So what is that doing to the foster care system in our state? And what resources are available to help those organizations?
It's stressing every organization that deals with children. I mean, it is, and as I said earlier, grandparents are probably the first level or the first choice to go to. And, one of the other statistics are 40% of the grandparents that are caring for children are over 60. It has a snowballing effect. Grandparents are very difficult to deal with because just as Allyson said, a lot of times they'll do it because the stigma, they don't want to make it public as to what's going on, or if they're having these problems in their family, and they try and do it. So there's a lot of information out there that probably we're not getting the right information. We're not getting the right statistics. There's probably more of this going on than what we really know.
Very often it's secretive because there's fear of the unknown. They're afraid that children will be taken away.
That's
the grandchildren will be taken away.
Somebody else outside the family is going to take care of my grandchildren, and that's a devastating thought for a lot of people.
So what more do you think needs to be done? We were talking about this earlier, and you were saying medication-assisted treatment is really important. Why is that? And explain what medication-assisted treatment is.
Medication-assisted treatment it really is assisted treatment for an addict or somebody who has an opioid problem, and it could be Suboxone, Vivitrol, or any of those programs. It is not to help the person withdraw, or they have to detox before they can get involved in any of these programs. The bottom line in the simplest terms is this, is that it helps the person become a productive member of society. They can get a job. What it will do is, I'm looking at it like it will relieve the stress, maybe get the person out of jail, maybe get the mother of the grandchildren a job, let them at least be a productive member of society, which in turn is going to relieve the pressure on the grandparents, I think.
But some people may argue and say you're taking away one drug and giving them another drug.
Well, I think what we need to remember is it's not magic. So it's not just taking a pill and feeling better, because that's how, we have these problems. But I think what we need to remember is it's hard work, and treatment is the key to that. So the medical is important. The medicine is extremely important, and that is helping with that brain disease and what opioids are doing to the person. But we also have to remember there's a big picture here, and treatment is a big part of that.
Counseling.
Yeah, absolutely. Counseling. Recovery is not easy. It's hard work.
There has to be a continuum of care. All the way through. I mean, anything standing alone is not going to solve the problem. I think everybody would agree to that.
And if you have a problem, please call 1-800-662-HELP. Their phone lines are open, and someone is available to speak with you. Well, you're saying help and treatment. It's very important. But what about abstinence? I mean, doesn't that work as well?
For some people, but I think that one of the problems that we have historically is virtually every one of our recovery programs was based on abstinence. And, it's like, here's what I would say. If I'm a diabetic, you can't send me away for 28 days and I come back and I'm fixed. It's the same thing with the heroin opioid problem. There's significant research that it affects your brain. It changes the makeup of your brain. So we can't expect to send somebody away and then they come back and, okay, you don't have to worry about drugs again ever. It just doesn't work. It's just like a diabetic needs to take insulin every day because they don't process sugar properly. Some people have never had the ability to process opioids properly. And, it's not a moral shortcoming. That person is not a lesser person. It's just the way that their body happens to be made up and their reaction to certain chemicals.
Cammie, how do we prevent this from even starting in the first place?
Education.
With kids.
Absolutely. And when you say abstinence, and I understand what you're saying with treatment, but that is what I say to kids all the time in 4th grade. The easiest thing is don't ever pick up. Don't ever start.
Just don't do it.
Just don't do this, whether it's smoking,
and you never
vaping.
Have to worry about your brain changing.
Then we don't have to worry about that.
What advice do you have for parents who are watching? What can parents say to their kids? Or what can we do? Do we just involve them in activity after activity after activity?
We don't overstress them. We can do that. We can be a part of their lives, and we need to talk to them. I think one of the things I do, and I know this is a little later, but when I talk to kids in a high school who have already experimented or used, I ask why. And whether it's a 6th grader who's trying vaping or a 12th grader who's taking Percocet, why? What is going on in your life? Well, there's a lot of different reasons.
Like?
A lot of kids, it's escapism for some. Some don't want to feel. They want to feel differently. There's a lot of different reasons we pick up for the first time. But I think as parents, we need to find out why.
It's just sad because you hear so many stories from parents. Well, you know, my kid was a straight A student, honor roll student. He played sports. He had friends. All of a sudden, things changed almost overnight.
Absolutely.
So what I'm asking is, how do we prevent that from continuing, from happening, you know, to more kids?
Well, we just stay on it. We keep educating, we keep talking about it. What we're doing right now, we keep talking about it because, again, 10 or 15 years ago, we weren't talking about opioids because we didn't think it was going to be an issue.
The phrase
and
that
here
keeps
we are.
coming up is to ask questions.
Yes.
Of your kids?
They need to be talking to their children openly and honestly. Addiction is not, it's not a stereotype. It is our athletes, and it is our underprivileged, and it is the honor roll student.
It's people you would never suspect.
Yes. Correct.
It's your
so
neighbor.
you need to be involved in asking questions.
We've tried to change something. I'll give you a very small example that the legislature did. If you're going to prescribe opioids for a minor, why we picked minors, they have to be counseled, and there's no more than 7-day prescription.
But not just minors, adults now too,
well,
right?
no, not yet. We're working on adults. But the reason for minors is this. It's been mentioned about they're the athletes, and that's when people get their wisdom teeth pulled. And an awful lot of people, and it still goes on, the first thing you get when you walk in the dentist's office is a prescription for 20 Vicodin or something like that. So we've changed that. It's like I said, we're trying to change things slowly, and once all these things get put together, I think it will have an effect.
Absolutely.
Jamie, what do you think, or what's your advice for parents out there? What should we be talking to our kids about, or how should we be talking to our kids, and what kinds of things should we be saying to just avoid all of this?
Well, we need, like they've mentioned, you need to have an open dialogue with the kids. And I think one of the parts that haven't been mentioned is the connection between drug and alcohol use and mental health issues. When we looked at the PAU survey, one of the things that stands out from it is how many kids feel depressed, how many kids feel hopeless, or that, like they don't have a reason to continue living. And so they turn to drugs and alcohol to self-medicate to deal with those kind of feelings. And it's not like teenagers now are the first group that ever felt like they weren't connected, that they felt down about different things. It's a very hard transitional time in their lives. And parents need to be watching for those kind of symptoms too. Parents need to not only talk the talk, but they need to walk the walk.
So parents need to be...
if your child sees that you're utilizing alcohol in an inappropriate way, or if you're experimenting with drugs or you use drugs openly around them, they're much more likely to feel like that would be okay. Parents who are permissive about allowing kids to party in their homes, thinking that, oh, at least they're supervised here, that's kind of a fallacy. That's a permission. So, if you're okay with it in your home, then they'll have other friends who their parents will be okay with it in their homes, and that encourages that kind of behavior.
Okay.
Making sure that the kids are active, but not too active, because that in and of itself can be overwhelming.
Jamie. Thank you very much. Unfortunately, we're out of time. I'd like to thank all of our panel members for being a part of this important discussion. Remember, recovery starts with a phone call. If you or someone you know is suffering from addiction, please call 1-800-662-HELP or visit battlingopioids.org for more information. On behalf of Pennsylvania Public Media, I'm Paula Giangiacomo. Thank you for watching.
Major funding for Battling Opioids has been provided by...
It doesn't take long to become addicted to opioids. 13 Pennsylvanians die from them every day. Geisinger is committed to ending opioid addiction with both prevention and treatment. In the last 3 years, we've reduced the amount of opioids we prescribe by 50%, and we've opened 4 medication-assisted treatment centers across the state to help patients recover from addiction. Learn more at geisinger.org/hadenough.
Additional support has been provided by the Commonwealth of Pennsylvania and viewers like you. Thank you.